right. Well, TGIF, hello, and welcome everybody to the National Health Federation's monthly Zoom. Let's roll up our sleeves and clean up the remaining Vaxx mandates while also ensuring TechSafe Schools. So our guests today are Josh Yoder. He's a pilot and founder with US Freedom Flyers. We have Matthew Breeding. He's nurse and founder, Nurses for Liberty. We have Stacey Wilder. She's a trustee for Physicians and Patients Reclaiming Medicine. Greg Glaser, Counsel for the National Health Federation, Physicians for Informed Consent, and America's Frontline Doctors. Doug Wood, founder, Americans for Responsible Technology, and Scott Cameron Tips, National Health Federation President and General Counsel.
I'm glad you got my middle name in there, Alex, because otherwise it wouldn't have been right. Thank you.
Anytime.
Hey,
And
Alex.
there's Greg.
All right, Alex. Well, thanks for listing the speakers. And as the speakers know, we want to kind of be concise with our pitches, just to give folks a quick update while we're here. And then we're going to have the fun that we always expect every month during the Q&A. I'm Charlie Froman, the lobbyist for NHF. And we're really pleased we get such good attendance every month with the speakers and topics. We do have to cooperate for health freedom, and it's nice to see the movement growing. And at the end, Scott will give us a comprehensive rundown on the status of health freedom. But as usual, we're going to start with the greatest threat to that health, which is the vaccine mandates that emanate from the COVID hysteria. And Josh Yoder is a pilot with one of the mainstream airlines, and he runs US Freedom Flyers. And Josh, you've been quite busy lately. When I think of pilots, I think of that comment from someone who's, quote, "I can't find anymore." But it struck me early on in the COVID hysteria. Someone said, you don't want to interfere with international exchange and trade because that is the natural vaccine. When you allow the mixing of the population, you really allow natural immunity to do its magic, to let the virus wear out. But that unfortunately was not allowed to happen, and the pilots were threatened with employment loss if they didn't join the experiment, and passengers were made to play Russian roulette to fly around the world. So Josh, tell us what's going on.
Well, I'll just give you the latest update on US Freedom Flyers. I think most people are probably aware of who we are, kind of how we got started. It started out with airline pilots standing up against the mandates, quickly expanded to other work groups and then out to other transportation groups as well. Due to standing up and raising such a ruckus at the airlines, many of them backed down. Out of the 27 that we represent, only 4 came out and said, get the jab or lose your job. As a matter of fact, right now, about 2 hours ago at Kalitta Airlines headquarters in Ypsilanti, Michigan, they just had a meeting and they walked all their unvaccinated employees off the job. All those who had religious exemptions, those with medical exemptions from the January 4th date were given 1 year until termination. And if you had a religious exemption, you were given, I believe, 3 months, and they were just walked off the job today. So the threat is very real to these employees. And what we're doing right now is we're filing 4 additional lawsuits at US Freedom Flyers. We currently have one in the courts suing the Joe Biden administration on behalf of the federal contractor clause of the mandate. And now we're preparing to file 4 additional suits against Kalitta Airlines, Atlas Airlines, United, and Omni Air International, most of those being cargo companies. As far as the way this pertains to passengers, what they're doing to employees, a lot of passengers are probably asking themselves why they should get involved in our fight, helping save employee jobs. What they don't realize is that what they've done to air crew and to employees, they have every intention to do to passengers. So just on a couple of fronts, HR Bill 4980 is something that's been proposed by Richie Torres out of New York, that if you're unvaccinated, they're going to lock you down where you can't arrive or depart a U.S. airport. So helping the employees win these cases and setting the precedent is going to protect the passenger as well going forward. And I'm sure most people aren't aware of this, but if you read the fine print when you buy an airline ticket, there are several major airlines out there now who already have vaccine passport language in the fine print of the tickets. So they are absolutely believing or planning on moving ahead with this, both domestically and internationally. So it's absolutely critical that passengers go to usfreedomflyers.org, sign up, and if you can, donate to our legal cases. This is very expensive. We all work for free at US Freedom Flyers. None of us takes a dime. We do it because we care about the issue. And this is really about preserving our freedoms. It's not just about not getting a vaccine that we don't want.
That was concise and perfect, Josh. If you don't mind, if you see the chat window, if you could maybe put the link how folks can support your lawsuits, and we'll probably in Q&A want to go back to that passport language that you said is just waiting to be implemented, and that is a big scare that people need to be worried about, particularly around the nationalization of vaccine registries. For which NHF does have a campaign, and I'll put that link in chat as well. And Matthew, for Nurses for Liberty, I thought it was Nurses for Freedom. We're all worried about health status discrimination. If we're a patient in a hospital, can we get care if we're not vaccinated? We hear about the malpractice against COVID patients. There's still not much early treatment. And as a frontline nurse, Matthew, if you want to unmute yourself and give us your pitch about what's going on with the nurses, go ahead.
Well, I mean, there's all kinds of stuff going on. Nurses for Liberty was founded because, well, the SCOTUS decision came in the same day on the CMS mandates as it did for the OSHA mandates, and healthcare workers kind of got forgotten. Everybody was celebrating the overruling of the OSHA mandates while the CMS mandates were swept under the rug. And really, the heroes of the pandemic for the first half of it just got forgotten, and nobody really cared about healthcare workers' right to their health of bodily autonomy. So I just wanted to come up with a protest for against the mandates, basically, and I was looking for legislation that would push and nullify the Supreme Court ruling, and the NICE Act seems to be the exact language, the exact legislation that we need to promote informed consent for all, not only healthcare workers, but it would, in effect, nullify the CMS mandates that are in effect now. So on July 16th, we will be marching in DC in support of the NICE Act and in protest of the CMS guidelines. And I was just notified today that the facility that I work at is requiring boosters or twice weekly testing, which I live in Iowa, a relatively free state. So I haven't lost my job, but I've been testing twice weekly since the beginning of this thing. So just trying to get back to where, we control our own bodies, I guess. So if you're free and have a chance to come to DC on the 16th of July, we would love to have support there and help us end the medical tyranny.
Explain the July 16th event again, Matthew.
So July 16th, we're going to be marching from Constitution Gardens to the Capitol building. Well, the end of the National Mall there, right in front of the Capitol building. Essentially carrying the spirit of the Constitution with us so that maybe our Congress people can realize that this is 100% unconstitutional. There's nothing in the Constitution enumerating the power to mandate vaccines or a million other things that are mandated. The common argument is the Commerce Clause. The problem with that is the fact that the Commerce Clause is a power enumerated to Congress, not the executive branch, and CMS, part of DHS, is a part of the executive branch, so that's not a power that they hold. And the 10th Amendment says that any power not enumerated to the federal government within the Constitution is given to the states or the people. So that's what we're going to be there standing for.
And is this a Nurses for Liberty event, or is it a more of a coalition event?
This is a Nurses for Liberty event. I've spoke with American Frontline Nurses and Nurse Freedom Network, and they're both going to be in attendance and speaking. So I'm going to have Nicole Siratek, Jody O'Malley, and Kimberly Overton will be there speaking. And I'm trying to get the authors of the NICE Act there to speak as well. We had some scheduling things. Originally, we were going to do this at the end of April, but it wasn't going to work out with the speakers, so we went ahead and moved it to July. So some things have changed, but working on getting all the logistics figured out.
Well, that's good. We have Greg Glaser coming on in a second. The council working with National Health Federation on the NICE Act, which we helped author with Congressman Gomert. So we're pleased to have such a broad coalition. And in the link, I put the place where you can find the NICE Act and other campaigns that we're sponsoring on health freedom. So please send those emails to Congress. Thanks, Matthew. If you could put a link to your organization in chat and maybe the July 16th event where folks can join you on that. And we'll have Q&A, of course, to follow up with you. But the CMS mandate is still in place and nurses are losing their jobs, correct?
Absolutely.
Okay.
Especially in less free states.
Okay, that's shocking. Stacey, so you have a excuse me, a relatively new organization, Physicians and Patients Reclaiming Medicine. It sounds like a great group to support and hear about. So what is your priority right now, Stacey? If you want to unmute yourself, Stacey, are you there? Stacey Wilder.
I did unmute. I don't know. I must click back on. Sorry. We are a newly formed organization. Like you just said, we're a private member organization. It was formed, it started by a group of concerned California physicians who have come under serious scrutiny from the California Medical Board, mainly for writing vaccine medical exemptions. And so they have done in the last several months to years is formed and have worked with attorneys and other physicians to start learning more about the legal process, their rights, how the medical board functions. And their current goal is to support physicians who are currently under investigation by their medical boards, not just in California, but nationwide. We do have other members that have joined in the last several months that are from other states that are being investigated by their medical boards, not just for vaccine exemptions, but with the COVID mandates they're trying to push through about spreading disinformation. There have been doctors that are already receiving notices from their medical boards. So this is a group that is putting physicians and attorneys together to learn how they can fight what is being directed against them. But in the long run, the goal is they're really, like their title says, they're trying to reclaim medicine. They're trying to work not just with physicians and attorneys, but bring in patients to bring back the individualized patient care model, not the one size fits all, really emphasize the idea of do no harm. And they want to do that by, kind of eliminating the interference, so to speak, that comes with medical boards, legislation, media, the pharmaceutical industry. They really want the power to be put back into the medical caregivers and the people receiving the care. So we are a newly formed group. We've just been forming our boards, our trustees. We have a brand new website that is still in the works. And I can send links to that. Nothing is completely active. Part of the reason we're jumping on now with your invitation, even though we are so new, is we would just like to get the word out to people. If there's anybody who wants to join in with our group, or if there's any physicians out there who are in need of assistance or want to learn more, we want to let them know about our organization and invite them to come join us and see if we can provide any help to them.
Indeed, Stacey, you mentioned several things that we'll want to cover in the Q&A. One is, how do we get out from under the thumb of the politicized medical board tyranny? And you mentioned PMA, private membership association. That is a unique model that is rising in popularity, is it not, for people that want to access good doctors, maybe outside the licensing regime?
I believe so. I'm a little new to this myself. I do know the idea of a PMA is it gives a little more freedom in how you can run your organization. I do know when we were establishing this group, they looked, at being a 501c3, and that seemed to have restrictions that didn't really work with the needs of this group or what the direction this group wants to go in. So it was decided to go down the path of a PMA. Okay,
well, we can revisit that in the Q&A because there's a lot of chatter about PMAs, as well as what the solution is to the licensing politicization, whether it's private certification or broader safe harbors and exemptions. And a lot of folks are working on that as well, including here at NHF. Thank you, Stacey. And Greg, if you're there, you heard Nurses for Liberty endorse our bill to establish a national informed consent exemption from all vaccination and to stop the federal government from continuing to ignore the needed study of the unvaccinated, to have that control group comparison, which would expose the real epidemic, which is chronic disease. And once people realize the implication of vaccines in the fact that half our country is chronically diseased, that's going to expand concern from COVID vaccination to all vaccination. What do you think about that, Greg, with the expanded support for the NICE Act and maybe an update on the lawsuits that you're involved with?
Absolutely. Yes, I'm so pleased to hear from Matt today about the NICE Act and the support that's coming from Nurses for Liberty. Matt is correct. The NICE Act would solve all of this. It would protect everyone's right to refuse a vaccination without being coerced or subject to duress. That means you get to go to work, you get to go to school, you get to go to court, for example. Did you know that courts are even blocking lawyers from entering the building in some jurisdictions if they're unvaccinated? And this is obviously a systemic problem. NICE is the systemic solution. And I am so pleased with NHF to support NICE. And the language of it is really good. It's really strong. And now I think is the time for it. The coalition for NICE is growing so large. We have groups representing millions of Americans. The list is so long, I can barely keep track of it, but I am keeping track of it. And so, yeah, what's being shown here is the NICE Act website. So folks can go to niceact.org to get involved. Here's the full list of groups. All the groups highlighted in red have submitted a letter in support. All the others have indicated their support to our team, letting us know that they endorse the bill. And this is just a partial list, we're just putting it together. We either have the support of millions of Americans or tens of millions. I need to count it up. And that means that we are getting close to a point of population awareness, population level awareness. It's sort of on the same level as the trucker convoy. You reach a certain, you reach a certain large mass of people, and then it begins to create the kind of political will, the kind of political change necessary to get Congress's attention. So very, pleased about what's happening here with the NICE Act. Also, as Charlie highlighted, I can give an update on some of the other things I'm working on. I represent several groups, several health freedom groups that with synergistic purposes. So Physicians for Informed Consent, America's Frontline Doctors, National Health Federation, groups coming together with synergistic missions. So for example, for America's Frontline Doctors, I was able to obtain public records from the University of California. I will be in court in 2 weeks to argue to the judge that the University of California not only developed the COVID vaccines, helped develop them, but received billions of dollars. That's billions with a B from Pfizer, Fauci, and then they turn around and mandate that very product. So I'll be in court arguing against the mandates in a couple of weeks. I'm really looking forward to that. And I have all sorts of great evidence. For Physicians for Informed Consent, we continue to produce helpful educational documents. One of our focuses as a doctors organization is to review the stuff that the FDA is producing, that CDC is producing. So we review all of those official type documents and then publish on the risks of vaccination. PIC will be supporting the Defeat the Mandates rally in LA on April 10th. So we're really looking forward to that as well. I think that's really important at this time to get to unify as a movement, to come together, and we have diverse talents, we have diverse interests, but we have the same mission, which is to overturn the mandates. So unity is so important right now. I just encourage everyone, whenever you're working, just always keep that in mind, that unity is going to make us so strong. For the control group, a case that I am litigating in federal court, I have some good news. I was able to successfully recuse 2 judges who own pharma stock. I'm not aware of other lawyers who've been able to do this because I think most lawyers don't want to try. They're worried of, upsetting the court, but I am not. I made it very clear that I don't want any judges on my case who own pharmaceutical stock. And so I was able to get two judges to step down. And my next step in that case is a petition for a writ of certiorari to the U.S. Supreme Court. And folks can stay tuned on that by going to informedconsentdefense.org. Thank you.
Thank you, Greg. And at the link I put in chat a while ago, one of the top issues is the importance of opposing the FDA's expansion of the emergency authorization to ever younger kids. And Pfizer withdrew from that effort for a bit, and apparently they're coming back. So the kids need our help with the vaccines. The kids need our help also with the inevitable deployment of wireless antennas outside our bedrooms and our kids' classrooms. And to stop the kids' classroom deployment, we have Doug Wood from Americans for Responsible Technology, who's going to talk about TechSafe Schools. Doug, how important is this issue for health freedom and our kids?
Well, first of all, I'm very honored to be here with you all who are fighting for health freedom, totally supporting what you're doing. It's not the focus of our organization, but I just want to say I'm 100% behind it. Our organization is focused mostly on the impact of environmental toxins and how they affect humans. This TechSafe Schools project is a project of grassroots environmental education. That's our nonprofit organization. We've been around for 20 years. We wrote the law in New York State that banned pesticides at all schools, public and private, K through 12. And we've been in other fights like that. We just got New York City to ban pesticides in all their public parks. We became involved in the issue of wireless radiation and its effect on health based on Hugh Taylor's work at Yale University, in addition to many other studies that have gone on for years that have demonstrated serious impacts, biological effects of wireless radiation, even at levels that are far below current FCC guidelines. This current project that we have called TechSafe Schools is really designed to reduce the amount of involuntary exposure that our children are having to wireless radiation in classrooms across the United States. I think you probably know, if you have kids or even if you don't, that the industry has been successful in infiltrating every single classroom in the entire United States is now outfitted with pretty powerful Wi-Fi that's on all day. Kind of subjecting our kids to this radiation, and we're concerned about that. The program is built on 3 legs. Basically, there's a legal leg. We are advising schools, school administrators of their legal responsibility as advocates for the children and their care. They have a fiduciary responsibility that's outlined in a number of state and federal laws. And if they don't know about the radiation that's in their classrooms and they haven't tested it and they're not measuring it, technically they're really in violation of many laws that are already on the books. We have a lot of science around this. These are peer-reviewed studies that cover a wide range of potential effects of wireless radiation, as I said, at levels far below what the current FCC limit is. And then there's plenty of things that schools can do to reduce that radiation. We have a couple of schools where they were able to reduce the power from their routers by 95%, and everything still worked fine, which gives you an idea. Most equipment of this type is, they open it up at the school, it's set for, a power level of 11, and they just put it on and turn it on, and gee, it's great, everybody's connected. They don't realize how much more radiation they're putting out than they really need to. And we are looking now for parents who would like to be kind of part of our program and kind of be the third leg of our stool between our organization, which produces all the information, the legal letter and so on, the school, which gets the information. Having a local parent involved in this program really helps us close the loop and make things happen. So we are in the process of looking for more parents who want to be advocates with us, and there's more information about that on the website. It's techsafeschools.org, all one word. And I'll just give you a quick update. I was here a little while ago talking about the lawsuit that we have against the FDA for failing to actually set standards, which they are required to do under law. The FDA, not surprising to anybody on this call, the FDA has not been terribly responsive. We were not disappointed or surprised when they didn't call us up and say, gee, we didn't realize this, thanks so much. And so we are headed to court. We expect to file in court at the end of this month to force the FDA to do what it's supposed to do. And that's my report. Thank you so much, Charlie, for inviting me here. I'm really happy to be here with all of you.
Thank you, Doug. And I'll share the screen so you can see the NHF campaign as well on 5G. You just go to the link that I put in chat and scroll down. And right here at the bottom, based on the infrastructure bill that Biden passed for broadband, we want to have more of that money go to wired, not wireless. And we have other 5G and wireless issues as well that support the mitigation that Doug is talking about to keep the antennas away from our kids' schools and our bedrooms and our offices. So, we're all in this together. We all have various plans, and so help each other out, and it's help our kids. We'll get back to Doug in Q&A. And finally, Scott, you have a broader update on health freedom that you wanted to share?
Yes, I basically did, and I will. Thanks to everyone who is present today for being part of our NHF Zoom meeting. I just want to say quickly before I got into what I had to say in answer to something that Matt Breeding had commented on. I want to say that Congress, the flaw in a lot of these regulatory agencies is they cannot be delegated lawmaking power by Congress. It's actually forbidden by the Constitution. And so there's this great book, I don't know if you can see this cover, called Judicial Fortitude, which I encourage you to get and read. And it's by Peter Wallison. And he points out in it, amongst many other things, he points out in it that For example, in 2017, Congress passed 97 laws, but the regulatory agencies enacted 3,281 rules. And so we can see from this, and this book highlights both the problem and an answer, that the courts have deferred and Congress has deferred greatly to all these regulatory agencies that are out there, unelected bureaucrats passing laws right and left, but they don't call them laws. They call them rules. They call them regulations. They call them guidelines. Sometimes they call them mandates, and they actually have zero authority to do that. But what Congress does and has been doing since about, say, the Clean Water Act, say the mid 1970s, is they have a broad plan. They say, we want the water cleaned up. Now, EPA, you do it, and you figure out the way it's going to be cleaned up. Well, this happens time after time after time with Congress. And Congress and the senators and Congress critters, they love this because they don't have to get immersed in the details like they used to. They leave that to the regulatory agencies. But with that, they're conferring a lot of unconstitutional power to the FDA, to the EPA, to the FTC, to the, you name it, whatever the regulatory agency is, they've gotten a lot of power. And unfortunately, because of the US Supreme Court case in 1984, which Chevron versus the Natural Resources Defense Council, that decision basically just punted the ball into the corner of the regulatory agencies and said, just so long as your actions are reasonable, we have no call to question or challenge them. So that just reasonable. What is reasonable? It could be many, many different things. So this is really a major problem. We need to get rid of the Chevron case. We need to limit the power of the regulatory agencies and eliminate a lot of these regulatory agencies. Frankly, the world would be a better place if the FDA no longer existed. The world would be a better place if the FTC didn't exist. People are afraid of this, though. They think they're still harboring this misconception that these regulatory agencies are protecting the consumer and the public, when all they are just hired thug guns for big industry, for big agriculture, for the big pharmaceutical companies, for you name it, for the vaccine industry and the like. So that was just something I wanted to say, kind of in support and parallel to what Matt was talking about, and actually what some of the other people were talking about as well. More to the point on what I was going to say is that, and this flows a little bit from what Greg Glaser already mentioned, but expands upon it a bit. And that is that, you know, it's nice that we're seeing a lot of retraction of the COVID-19 mandates and all of that. But I think we need to be really prepared for the next onslaught. You know, it seems like each year they ratchet it up bit by bit. So, you know, they had the SARS epidemic. Oh, they had the swine flu vaccine and problem in 1976, and it killed, the vaccine killed a lot of people, and they withdrew it from the marketplace. And then, you know, you had SARS epidemic, you had the Hong Kong flu, you had the Zika virus, and now we're starting to get into these bioweapons viruses that are being created by these mad men and women scientists in these bioweapons labs throughout the world, funded by our taxpayer dollars and by the inflation that we're seeing by the printing electronically and in print of the US currency. So what I fear will happen is we'll retrace a bit with these COVID mandates falling by the wayside. And here in Europe, we're seeing that. Belgium has dropped all its COVID requirements and restrictions. The Netherlands had done that a little bit previously, the UK before that. And we're seeing that happen in the States somewhat as well. Not the communistic Canadian government, but some others. And especially the Western provinces are waking up to the fact to let some of this drop. But what's going to happen next is there will be something like, maybe a Marburg virus, or, which is an Ebola-like hemorrhagic fever with 88% mortality. But I'm not saying they'll release that, but they'll probably do like an attenuated version of it, because they don't want to be at risk of dying either. And who are they? They are the elite who really run these countries. Politics is mostly a sideshow, and the real work gets done by the unelected bureaucrats in the agencies and amongst the elite who tell them what to do. And it was very evident, at least to me and to many others, that all of this was orchestrated. When you looked around the world and you saw country after country falling into place with the same kind of the same mantra about COVID, whether it was the UK or France or Spain or Brazil or Mexico. Well, Mexico was a little bit of an exception, but Canada and the US certainly were not. And it was all very carefully orchestrated. So now they're retreating a bit, sort of 2 steps forward, 1 step back philosophy. So the next one will be a major one, and they'll make it even scarier. And people will rush to get the vaccine that will be out there. They've already developed a PCR test for Marburg, even though there's no official pandemic about it. And they've already started working on a vaccine for Marburg. So whenever you see them doing stuff like this, to be prepared. This is the next thing that's going to come out. Not meaning to toot NHF's horn too much, but if you were a member of NHF in January of 2020, you would have gotten this issue of the magazine talking about COVID-19 way before anyone else. And this issue told you don't have to fear COVID. And then the very next issue had an article that I wrote about how the COVID, you really had more to fear from the government and its reaction to COVID than you did to COVID itself. So NHF has really been a little bit ahead of sometimes a lot ahead of the curve in warning the public about these kind of things. And this is a warning right now on this program that there's a next thing that's going to come, and the vaccine will be far more dangerous than even the COVID vaccine. So a new pandemic will almost certainly be declared. And they will claim that there's probably an asymptomatic spread. So how do we stop all of this before it happens? And I'm just about done, Charlie, here. So don't worry, I won't drag it on for the rest of the time we have. But it seems to me there are 2 main things, and maybe 2.5 main things. One is that we really need to prosecute the people who push the COVID-19 pandemic, scamdemic storyline, whether it's Fauci, no matter whom it is, the people at the CDC, all of that need to be made accountable. And we need to raise our voices in unison, because if we scare them away by saying, look, these people got caught and punished, or at least many of them did, they'll be less likely to release the next virus that they'll use as a justification and an excuse to limit and restrict our liberties. So that's number one. Number 2 is we need to have a concerted campaign to outlaw all bioweapons lab research, because that's where all these dangerous things are coming from. They're coming from these bioweapons lab research, and in conjunction with some other universities and medical centers. But really the main engine are the Wuhan type, the Ukraine bioweapons labs. I mean, they're all around the world, and they need to be stopped. And there's actually an international treaty that was proposed some time ago by Russia and supported by others. And I haven't read that yet, but assuming it is what it says it is, it might be worth supporting or coming up with our own proposal on that. But we've got to stop that. Otherwise, there's going to be the Marburg virus next time, and after that, there will be something else out there. These people are psychotic. They have an anti-human agenda, and they won't stop until they totally control the world. And sounds like a scene from a James Bond movie or something, Spectre is out there going to get the world. But I mean, we've seen the evidence of it. We all have. We've experienced it. So we need to stop it. And the best way to stop it is make these people accountable. Oh, and the HAP thing that I almost forgot, and this is where it ties in with Greg, is the NICE Act. Because if we have an exemption that we can get out of the Marburg virus vaccine, then we're protected. So that's an important component to all of this. So maybe there are three legs to stand on to protect us from the next big pandemic that's going to break upon our shores. That's it, Charlie.
Outstanding. I think a lot of folks are worried that the rollback of some of these mandates are going to make people too comfortable. And that's exactly what these great reset elitists want. And then they'll switch to the carbon footprint, the digital currency, and the vaccine passport infrastructure that even Joshua mentioned are in the airplane tickets, ready to control us, a la the social credit scheme of the commies in China. So folks, if you could click the raise hand icon, let's get this Q&A session going. And I'll start. Stacey, you mentioned a colleague of yours is available to speak about private membership associations briefly.
Yes. My fellow trustee, Dan Wheeler, joined the call. He's one of our attorneys, and he knows more about the PMAs than I do. So he can answer your questions better if you have any, or I don't know if you just want him to give a brief summary really quick or just wait for questions. It's up to you.
Dan, if you want to do a quick minute on PMAs, their importance in the health freedom efforts to allow more personalized medicine and experimental treatments. Go ahead.
Sure. Thank you. We have formed a private membership association, or a PMA for short. The name of it is Physicians and Patients Reclaiming Medicine. The main goal of the organization is to invite patient members, that is non-doctors, and invite physician or medical doctor members to pursue a common goal, which is freeing doctors from the oppression of medical boards who are now disciplining doctors and revoking their license for things like speaking publicly against the public health narrative or granting medical exemptions from public health mandates. It is the fear of delicensure that has silenced most doctors across the country. So it's our view that if we can remove this fear of capricious delicensure, if we can win cases against the boards, this will encourage doctors across the country to follow their conscience, to speak out, to grant medical exemptions, to practice medicine the way it was intended to be practiced. That's our goal. The reason we chose a PMA as the form of organization is to capitalize on the First Amendment's protection of the freedom of association. Because it is an association, and one premised upon this First Amendment right, it offers enhanced privacy protections, and it, as best we're able, minimizes or avoids the jurisdiction of, for example, the medical boards. It avoids the jurisdiction of the IRS, which would apply to a registered nonprofit, a 501 organization. Avoids the jurisdiction of the Secretary of State if you were to set up a corporation or a limited liability company. So it is designed to provide maximum freedom of operations, of pursuing activities there's really nothing, very little we can't do. For the time being, this is not meant to be a way for doctors to practice medicine outside the medical board licensing system. So that this organization is not pursuing that goal, but we are pursuing the goal of uniting patients around their doctors and freeing them to practice medicine independently. Thank you.
Thank you, Dan. And we'll revisit this issue because PMA is definitely a part of the future of medicine in so many ways. Joshua, could you discuss a bit more about the vaccine passport language that's already in the tickets that people are getting to fly around the world, and why that people need to be very concerned about that?
Well, we know that once, they put the language in there as a precursor, so we know it's coming. And they're essentially just waiting on the legislation to back them up. The airlines have proven from day one that they're in bed with the government. The unions are providing no protection for employees or for the freedom of passengers. It's like, I forget who said it, like, they're showing us what they're going to do next, and this is something like no one's been really paying attention to it. It was brought to my attention about 3 months ago. That was when I first started following it. And there needs to be major outcry. Everyone needs to contact their state and or their local, state, and federal representatives, and make sure that you make your voices heard there, because they're just quietly pushing this through. Both parties are going along with it. I mean, we see state registrations for vaccine passports, that type of thing. Is it's being rolled out very quietly. So it's definitely something that's coming if we don't stand up with a very unified voice and push back against it. And we've also seen this up in Canada and other countries around the world where they're actually, they're already requiring the vaccine to fly. And it's only a matter of time until they're trying to make this a worldwide program.
And I'll be working on a campaign to that effect to stop the passport infrastructure and the World Health Organization pandemic treaty. Thus far, at this link that I put in chat, you'll see about a couple months old effort to stop the nationalization of the registries that most states already have on who's vaccinated, as well as stop the national patient ID that Rand Paul is leading. All these issues are tied together, like you're saying, Josh. Thanks for that. Folks, if you click the raise hand icon, we'd love to have your comments or questions. Doug, obviously the COVID hysteria and the sabotaging of so many people's livelihoods around COVID has awakened them to the dangers of some of these public health measures. They're not as big scale-wise with the wireless dangers. Why do you think that is? And do you think that's changing? Or more folks waking up to the similar dynamic, the lack of informed consent, the suppression of the true science on wireless dangers?
I think they are. I think more people are becoming, I think 5G has woken a lot of people up, especially when a 5G transmitter gets planted on their front lawn, and all of a sudden they're wondering what's going on. And then they begin to find out all the medical problems that are associated with exposure to wireless, and the fact that, in many cases, the similarities, I was sitting here thinking the same thing, Charlie. The similarities are just amazing, where you've got the government and the wireless companies kind of conspiring to do what they want against the wishes and the well-being of the population. I think people are naturally protective of their children. It's one of the reasons that that we built the TechSafe School program, was to take advantage of the natural instinct of parents to be careful around their children. And I think people who haven't thought about it before, all of a sudden, when they realize their kids are pretty much sitting in a low power microwave oven all day, day after day, week after week, month after month. And I think anybody thinking about this can say, this could have some long-term effects on my kid, especially neurological effects, for which we have very good science. We also have really good science on behavioral effects, and we have this massive spike in ADHD over the past few years, and teachers are scratching their heads going, what's going on here? And we have very, very good science about behavioral problems caused by exposure to radio frequency radiation. So I think this is a growing area. I mean, I know we're going to win. We just have to be a little bit patient. But eventually I expect that everybody will recognize that there's a problem here. And I see a day coming where manufacturers are going to have to be more careful about what they put out there. They're certainly capable of making more safe equipment. And of course, wired technology is 100% safe, no health problems, future-proof, costs less likely to be hacked. I could go on and on.
And I'll mention again the list of campaigns that I put in chat to encourage the infrastructure supporting folks through broadband expansion, to emphasize the safety that Doug just mentioned and effectiveness of wired broadband, and the weird insistence on a wireless infrastructure. So thank you for that, Doug. We need to boost our natural immunity as part of that personalization of health. Greg Cunion and Scott Tips. FDA that was targeting natural treatments, NAC, they're threatening a mandatory list to subject natural products to drug-like regulations. How important is the supplement issue and other natural therapies, Greg and Scott? I know we're following that one too.
Well, go ahead, Greg. You can probably respond first.
Well, certainly it's been isolated cases, but you go down the list. What's most frustrating about it is that they're able to get these things passed without actually passing any laws. Folinic acid is one I talked about in the past, where suddenly it just vanished. You couldn't get it as a dietary supplement manufacturer. The only companies that were allowed to actually purchase it legitimately in the United States were drug manufacturers who were making the drug leucovorin. But there's no law from the FDA that states that folinic acid is now no longer considered a dietary supplement. The same thing has happened with N-acetylcysteine, which is, of course, for me personally, is causing Olaloa a lot of issues, in so much as we have been trying to maintain the status quo with what we've been doing for the last 23 years. And the FDA is, as they do routinely, taking their time, not making an official statement. And I would not be surprised if there is no statement for some time to come. And what's going to happen is that the suppliers will not make it available to the dietary supplement industry. Manufacturers of supplements will just take it off of their product list, and it will go by the wayside, just as folinic acid and vinpocetine. So it's very frustrating. And legally right now, Charlie, maybe you know a little bit more about where we stand right now with the NPA and the other groups that have been communicating with the FDA, because at the present time, I do not know where the FDA stands on this, and it doesn't seem like they want to respond.
Well, if I could answer that, Charlie. And basically the FDA, the branch of the FDA that made the decision that NAC was not a dietary supplement wasn't actually the branch of the FDA that's charged with making such decisions. Right. It was another branch. So they actually didn't have the internal authority to make that decision. But having said that, then it gets broadcast as if it's the whole FDA, or even the correct portion of the FDA, that had in fact made the decision that NAC was not a dietary supplement, was a drug. And they based that on the fact that after 39 years of use as a supplement, there was an inhalant drug composed of NAC. And yet there's no correlation. Typically, if you have something that's given by an inhalant method or an injection or something like that, that's something totally different than a dietary supplement. And even the FDA recognizes it as such. About 11 years ago, a little less than 11 years ago, the NHF had Representative Burton out of Indiana introduce a bill in Congress to change the date of the dividing line between grandfathered in dietary supplements and the new dietary ingredients. And we did that as perhaps an idea of the simplest way to protect a lot of these new dietary ingredients that were out there, because this is the most common way that the FDA is stopping dietary supplements is they're saying you have to provide us proof that this new dietary ingredient, NDI, that this NDI is safe and even effective. They're trying to apply drug standards to supplements now. Well, back in 1994, when the Dietary Supplement Health and Education Act was passed, it wasn't a big deal. October 15th, 1994 was the passage date of the Deshea law, and it wasn't a big deal. Almost everything was grandfathered in. But now, since then, there have been so many new dietary ingredients introduced in the marketplace. I forget the number, but it's something like 20 or 30,000. So it's a huge number. So if our bill had passed, we had it introduced in the fall of 2011, and it would have moved that separation date from October 15th, 1994 to January 1, 2007. And I won't even get into why that date was picked, but there was a logical reason behind it. And it would have grandfathered in thousands and thousands of new dietary ingredients. But unfortunately, we couldn't even get support amongst the health freedom community. For example, the Alliance for Natural Health opposed us on it. I can't even believe why they did that, but they opposed us on it. Other groups supported us on it. So it didn't go anywhere. But we're hoping with the NICE Act that has been done and that we're touting and getting a lot of organizations behind it, that this will pass. Now, obviously, that's dealing with vaccines, not with dietary supplements. But just to give you an idea, we need to have, when something like this is introduced, we really need to have everyone get behind it, because it's sort of like the saying, a rising tide floats all boats. So it's important to protect supplements, because supplements are what protect us from the increasing toxic world we live in, whether it be glyphosate in pesticides or Roundup with its arsenic content, or whatever it may be. And one thing that NHF has seen at these Codex Alimentarius meetings is that they're consistently trying to dumb down the vitamin content, nutrient intake that we have, and they're increasing the toxic load on us. And that's what NHF has been fighting for 22 years at Codex meetings. Sometimes we've won, sometimes we've lost, but at least we're in there fighting. I don't know if that answers your question, Charlie.
If I can add to that, so Greg, Scott, and I have a meeting with members of Congress and their staff against the new dietary ingredient guidance that still is pending after a decade at the FDA, and their efforts to get a mandatory listing. Supplements. Go ahead.
Can I say something about that? You know why we have that NDI guidance even out there? Because some low IQ idiots in the health food industry said, oh, we really need a guidance from the regulatory agency about what is an NDI. We really need you, FDA, to help us out and tell us we don't like this ambiguity. Well, you know what? The ambiguity was far better than what came out of the penmanship of the FDA. And so the health food industry asked for it, and they got it good and hard. So this should be a lesson to everyone. You don't ask a favor of the FDA. You don't ask them for guidance. You don't ask them for anything, because they won't give you what you want. They'll give you the opposite of what you want, because they're nothing more than hired thugs for the pharmaceutical industry. They could care less about us.
Do some reverse psychology on them, Scott.
Pardon?
Did I speak that out loud? I said, let's do some reverse psychology on them. We'll ask for what we don't want, so we get what
there you go.
Could you mute Pernille, please?
You can do that too, Charlie. Since
okay, and Jay, I think you have your hand up.
Yeah, thanks, Charles. I've been repeating a theme through these meetings for a while, and I'm getting less and less optimistic that it could gain legs, but I still think it's got important implications, and that is focusing on calling out the financial conflicts of interest that permeate all of this. The idea that almost half of the funding for the FDA comes from the pharmaceutical industry. my God, CNN is bringing on Anderson Cooper's segment and announcing it is sponsored by Pfizer. And it's not the announcement, it's what that reveals. The way I see this is, people talk about the Great Reset and the plans here. And I view it as like a pyramid where the most powerful have their hands in all of this shit, from banking to regulations to medical, energy, military, industrial complex. But then the next big portion of that pyramid is just people that are pretty financially empowered and where they are in their career, jockeying for position, more for me, empowerment. And at some point, we have to bring to bear, this is not cool for a civilization. That if you have an interest, I love the idea that Greg was able to get judges recused. And I think that might be a tiny key wedge to be able to expand upon. The notion that, I'm a pharmaceutical manufacturer and I get to donate money through my nonprofit arm to politicians and to news media and to the World Health Organization and on and on. I've talked about a concept, the Medical Conflicts of Interest Exposure and Disclosure Act. Just an idea. I don't know what good it would do, where it could go, but how do we start to bring about this raising of consciousness of mankind to where financial interests and regulatory interests have to be viewed, objectively, intelligently, rather than allowing those that have managed to get in a position of reasonable or massive empowerment to use that to control governing and regulations and laws, and education and so on. I mean, this to me is the biggest issue of all. And I think it has a lot of leverage, even if it doesn't gain legislative, hammer, power, because pointing it out and emphasizing it helps wake up the judge, the legislator, the public, the news thread, to where people can look more objectively. Why am I trusting the people that are making all the money to tell me that this is what I need? I don't know. Thoughts?
I have a response to that, Jay. I interviewed Foster Gamble last Thursday. So I highly recommend staying up to date with what Foster's doing and the work he's done to help educate humanity and raise our consciousness. So we're all on the same page, because from my understanding, the best solution is exposing the corruption. And once it's exposed, then we're able to implement solutions much easier. So
I appreciate you saying that. I was introduced to Foster about 6 months ago, and he and I did an hour and a half private Zoom call, hit it off incredibly well. I still worry about his trajectory, though. He calls things out and he suggests the solution is zero government.
Volunteerist.
How does a large group of people organize their life together without some governing? I mean, NHF has governance, and I worry that if we don't wake up the masses to what's going on and just isolate, the masses are going to let their cancer spread over us.
Well, without getting into a philosophical debate about libertarianism, Jay, send me your bill proposal if you don't mind, and I'll weigh it with some folks here and see what can be done about conflicts of interest, because it's a popular topic and probably something should be done about that. Cynthiana, you have your hand raised? Go ahead.
Yeah, I'd like, if you see in the chat at 12:50, I put a link for Solari, and that's an interview, part 1, with Beverly Rubick, PhD. She's one of the people who co-authored the paper, and I believe the other person is a medical person out of University of Pittsburgh. It's a man. And this is part 1 that is available without a subscription to Solari. It's really got everything in it. Part 2 isn't necessary. And this really is about tying together the injections with the 5G. And we keep for me, it seems like we as an organization are dancing around this a little bit, because I'm going back. I think I see Mary Brower is on this call. And I remember back when we had Daphne and the woman who is spearheading Virginians for Safe Technology. I know Daphne kind of really poo-poos this idea, poo-pooed the work of Alana Freeland. So I guess my question is, I have gotten a few people to really wake up once they've realized this connection is very real, or could be very real. So what does it take for us as an organization to get behind this research that seems to be gaining traction? Again, just today on Alana's site, La Quinta Columna came out with yet another series of what they studied to make the tie-in more cohesive. So is that something we can follow as a group?
Thanks, Cynthiana. Mary's on. Do you want to comment on that? And I'll comment before she does that. We have the tie-in just from the similar dynamic and how vaccine mandates and 5G deployment share a ignoring of informed consent because of the OTARD law and other laws. There's no way you can stop your neighbor from mounting a 5G transmitter on their roof. It's very difficult to stop a tower near you, and now they want to put these 5G transmitters on power lines and every other street lamp. As far as a closer tie-in with the vaccines and 5G, Mary, do you want to comment? If you're still on. She may not be on, but certainly it's an important issue. And with that, Alex, we're trying to keep this to an hour. If you want to invite anyone else for a last comment or question.
It looks like Mary's here. I'm trying to.
I think she's muted.
Yeah, but she's able to unmute herself. And
Mary, is your microphone plugged in?
Well, we'll have 5G like vaccines on every month, so we'll have plenty of time to discuss this in the future. I mean, think about the insurance disability death data finding 40% excess death. No media is touching that, so we'll have plenty to discuss always with these threats on health freedom. Anyone else? Alex, you want to invite last minute comments and close us out?
yeah, I mean, coming to my mind real quick is our dear colleague Bill Sardi's memorial is this Sunday, I believe. So just kind of holding a little moment of silence for Bill Sardi here, for those of us here who knew him. Thank you, everybody, for that. And I also wanted to say I made a Rumble page for the National Health Federation as an alternative to our YouTube channel. So this video was streaming live on our Facebook page, and I will download this and upload it to our Rumble.
And our next third Friday is April 15th.
Yeah, Friday before Earth Day.
I think April 15th is tax day. So be a fun day. Thanks, everyone.
Yep. Thank you, Charlie. Thank you, Scott.
Thank you, Alex and Charlie and everyone else who participated.
Good to see you.
And who listened.
Aloha, everybody.
And who listened.
Aloha.
Okay.
Bye now.
Bye for now, everybody.